All right. So once again, thank you all so much for joining our webinar today. This is our second education series, and really appreciate you all taking your time to be with us this afternoon or evening, depending on where you are. My name is Osei Boateng, and also the founder of OKB Hope Foundation. And it's my pleasure today to have one of our very own, Jason Elliott, who is also a mental health care provider at the Accra Psychiatric Hospital, and also the founder and the executive director of the Jason Elliott Foundation, that is really focused on providing, a lot of workshop in terms of mental health, music, and everything for the future generations. So it's my pleasure to have Jason here to really talk to us about addiction. With that much that I do, I will hand over to Jason to give us a little intro about himself, and then we will dive into the program for today.
Okay. Thank you very much, Mr. Osei Boateng. Thank you very much for the opportunity to be here with you. So, my name is Jason Elliott, as you said, and I'm a mental health practitioner at the Accra Psychiatric Hospital. I've been working there since 2013. And I also happen to be the president of the JE Foundation with a vision of mentoring and giving education to the younger generation and helping them live a purposeful life through a wide range of programs that we offer, from health education, music camps, motivational talk shows, and all of them. Yeah, and I'm a bass player as well. So, yeah, so basically that's about it.
Awesome. Thank you so much, Mr. Elliott, and thank you so much again for making it to the meeting today. So, today we have a very interesting topic on board about addiction, with your experience, really would like us to start off with, like, what is addiction and what does that even mean?
Okay. All right. First off, we need to understand that addiction is a disease. It's a chronic disease, meaning it doesn't happen overnight. It takes time to develop. All right. The American Society of Addiction Medicine defines it as a chronic brain disorder, meaning it doesn't happen overnight. It is not just the lack of willpower, but or as a result of making bad decisions. What some people think addiction is just someone not having the willpower or somebody making a bad decision. But in addiction, there's actually a change in the brain chemistry. So it's seen as a disease. We can also say addiction is a chronic condition that affects many aspects of your life, including physical and mental health. It can also affect your relationships and your career. We can look at two forms of addiction. That is substance use disorder, where we have the drugs, and then we have a behavioral addiction like the social media, TV, and other forms. So there are two main: the substance use disorders and then the behavioral addictions. We can also say it's when somebody obsessively thinks about a drug and uses them compulsively. Okay, so either drugs or alcohol, despite the negative consequence. So first of all, there is an obsession where the person thinks about the drugs. They can't control the way they think about the drug. And then there's a compulsion. That's an action following the obsessive thoughts to engage in the use of the drugs. That is addiction. Yes, we can also add that they don't really care about the consequences, whether it is causing harm to themselves or to others. Yeah.
Wow. Thank you so much for the brief overview of an addiction. It looks like there's a lot of things to really uncover when it comes to addiction in terms of like the substance abuse, behavioral. I'm really curious. Can you really deep dive into some of the substance abuse addiction, and also, if you can also talk a little bit about the behavioral one as well.
Okay, so with the behavior addictions, let me look at that one first. just as I mentioned, social media, phone, TV, and when you engage in this stuff, it takes a significant amount of your time, productive time, I mean, and you may not be able to engage in some social activities. So there's a compulsion to touch your phone every morning when you wake up, and some people can actually be on social media 24/7, and they can't do anything productive. Yeah, but those are the behavioral ones. We can also look at the sexual addictions as well. It's a little deep if you want to go into it. So let me just come to the substance use, some of the substances that people get addicted to. So we have classes. We can classify them based on the and liquor. All right. So alcohol is the most widely abused substance across most of the countries in the world, and to some extent, they have legalized it in some states. All right, but it creates feelings of euphoria and lowers inhibition. So that thing that makes you stop doing something that is risky, alcohol reduces or removes that thing, so you don't have those inhibitions anymore, and it depresses the central nervous system as well. So we can call it a depressant. We also have a group of drugs called opioids. Opioids are used as painkillers. So we have the heroin, and we have the pethidines, and I mean others. But what it does is that it mimics some of the neurotransmitters, natural neurotransmitters in the body, and that is why they use them as painkillers. But they are very, very addictive. And we can also look at benzodiazepines, which are usually used in sleep or treating sleep disorders, like the Valium, diazepam, and Ativan and Xanax. There are a lot of them. We also have cannabinoids, under which we have the marijuana and then the hashish. Then we have barbiturates. Some are used to treat epileptic disorders, like the phenobarbital. Another example is the Amital and the Lumina. Okay, but we can also classify them based on the effect it has on the individual, where we have the depressants. So, sorry. They make you feel down. They are not like those that give you an elated mood where you are high, you want to be aggressive and all this stuff. So the depressants, they depress the central nervous system. And we have examples like alcohol, the opioids, and then the barbiturates. Then we have the stimulants. These ones increase energy, and we call them the uppers. So they make you alert, and they give you that adrenaline rush. An example is the cocaine and then the meth. Then we have the hallucinogens. For this one, they actually alter your perceptions of reality. A laugh of highness. Yeah, then we have the inhalants, those that are inhaled. Example is the paint thinner and the nail polish remover, and also gasoline. Yeah, it will surprise you that people are addicted to these substances. Yeah, so basically, those are some of the things that people get addicted to.
So, thank you so much for the extensive explanation on the various ways. I mean, people get addicted to this. So I'm just curious, when it comes to addiction, definitely, you mentioned about some consequences that it has. So can you really delve into what are some ways that addiction affects people?
Okay. First of all, we can look at, the cycle. Let's look at how even somebody becomes addicted. Okay, so excuse me, just a moment. So we are going to look at the stages, and then I'll mention the cycle, and then we'll look at the consequences or some of the negative effects of addiction. Okay, so first of all, we have the experimentation phase, where the person tries the substances for the first time. It may be out of curiosity or peer influence. And at this stage, there is no regular occurrence. They might go back to use the drug, or they might even just end over there. Okay. Then after the phase, we have the regular use. Behavior is now forming. It is now becoming a behavior, but they still have control over it. It doesn't control them. So they may do it maybe once a week, or just when there is a program, or maybe a party or something. Okay, yeah. And then we come to tolerance. At this point, let me start to explain this point. And I felt good, and I started doing it regularly. So maybe every weekend, I'll just take it. It will get to a point I may need to increase the dosage from 1 thought to 2 thoughts to have the same feeling I had when I took it the first time. So that's what we refer to as tolerance. There's
I think maybe
use of the drug. Then we move from to the risky. Is that?
Yeah, there's like that. I guess the network is not stable, so it's cutting
sorry.
in and out. Yeah.
Sorry. Is it better now?
Yeah, it's better now.
Okay, so we move from the tolerance level to the risky use. At the level of the risky use, the behavior becomes very frequent, and there are negative consequences. So they may, engage in risky behaviors or experience problems in their personal and professional or academic life. Okay, that's where we term as risky use. Then we come to dependence. Now you move from using the drug for a reason to now it becomes a lifestyle. Like the way we breathe air. You don't plan to breathe.
Think
so you depend on the drug too. Hello, it's still breaking?
Yeah, it was breaking in now, so we missed the dependency point.
Okay, I'm going to go back to the dependence again, sorry. So at this point, the person's body and mind becomes accustomed to the substance or the behavior they are addicted to, okay? And I was saying that initially you are using the drug for a reason, to have to feel a particular way, okay? But at the dependence level, the drug controls you to use it, so that if you don't use the drug, you don't feel normal again. That is where the brain chemistry changes. So it becomes a part of you that when you don't take it, you are not normal. And at this point, when you don't take the drug, you are going to have what we call the withdrawal symptoms. I'm sure we're going to go into that. So after the level is what we get to engage in the behavior or use of the substance despite the negative consequences. At this point, it becomes difficult to control or stop the behavior, and it can have significant impact on the physical, mental, relationships, and overall well-being of the person. Okay. It is also important to know that not everyone progresses through the stages as I've mentioned. And once you get to the level of addiction, professional help is required. All right. Okay. Now we'll look at the cycle of addiction. Then we go to the effect it has on the individual. So that's one of the things, or due to a lot of factors. Maybe I lost a job, or is the line okay? Is the network okay?
Yeah, I mean it's still cutting in and out, but I think I don't know, maybe.
Oh, sorry. Let me go back to the cycle again. All right. Okay. So with a cycle, there's an initial use. That's the first time you encounter the drug or you use the drug. And it may be due to a lot of factors, maybe loss of a job, loss of a loved one, loss of a relationship, or maybe peer influence or any other factor. So from the initial use, you move to the state of abuse, where now you start abusing the drug, okay? Then we get to the tolerance, as I've explained. You need to use the drug at an increased dose to have the same effect, you were having at the initial use. Then we come to the level of dependence. Excuse me, let me respond to this work call. Just a moment, please. Just a moment. All right.
So hello everyone. Once again, thank you all so much for joining, and definitely for those who joined later, Mr. Eloit is talking about addiction and the different stages of it. And also, please, if you have any questions, please feel free to drop in the chat. And so once he is talking and you have any question, feel free to drop it in the chat and we will ask him once he's done explaining it. So yeah, once again, thank you all so much, and I'll be monitoring the chat for questions. So yeah, Mr. Eloit, you can continue.
Okay, thank you very much. Sorry for that interruption. All right.
No worries.
I mentioned initial use, then the abuse and tolerance. The tolerance is where you need to increase the dose of the drug to have the same feeling you had when you first used it. From tolerance, you go to dependence. At this point, you need to use the drug to feel normal. If you don't take the drug, you will start having issues. Then we get to addiction, which is the most severe stage. And then there may be a relapse, and then the cycle begins again. All right. So that is the cycle of addiction. That is what those who are addicted usually go through. It may not work for everybody. Some people can move from the stage of abuse to dependence. I mean, like they may jump the stages, right? Yeah. So now the question is, how does it affect the individual? All right. It affects different people in different ways. The first one is neglecting responsibilities. So a person that battles addiction at some point will usually become uninterested in their hobbies or normal interests. They might lose their job, drop out of school, stop paying bills, or abandon their children or family just to keep up with the addiction or the addictive behavior. All right. Then taking bigger risks. Someone that continues to participate in the addiction will have lower inhibitions. You know, when you want to take risk, as a normal person, we take calculated risk. But people who are addictive or addicts can take risks that will marvel you. They can put all their money and go and buy the drug. And you ask yourself, like, why would you do that? You know, they can sell their expensive phone to go and buy the drug, you know. And also, there are risky behaviors like unprotected sex, using dirty needles, hanging out with dangerous people, driving under drug influence, or stealing to keep up their habits. So these are risky behaviors that a normal person will find it difficult to do. But somebody who has a problem of addiction will do them easily. Then the next one is they put the drugs and the alcohol first. Addiction causes an obsession of the mind and a dependency in the body that makes people that have an addiction put drugs and alcohol above everything else. Even though their consequences have gotten high, they do not really care about anything else. Financial woes, relationship problems, and legal troubles begin to evolve to focus on the main concern of lessening withdrawal symptoms before they get overpowering. Logically, the person may know that their actions are hurting everyone, including themselves, even though they continue to black out, pass out, like people who drink alcohol can black out, but they will still go back and consume the drug. And then I think the last one is they refuse help. When you try to help them, they tell you they don't need help. They are okay, you know. So I think these are some of the effects it has on people. Yeah.
Awesome. Thank you so much for that.
Well, yeah. Before you come in, I mentioned that it could have physical issues, psychological problems, and relationship problems. So you may have loss of job, loss of marriage, detached from family, and even death. There are three things that we always say that the outcome of addiction is either institutionalization, death, or hospitalization. So you may even end up in prison or jail. You may even end up in jail, you may end up in a rehab, or you may die. So these are the three things that it may lead to, right?
Awesome. I know there's one question in the chat that I would love to read. So one person is asking, why is peptidine addiction common in the medical world and healthcare workers?
Okay. One of the causes of addiction is environmental influence, availability of the drug. If I was born in a place where alcohol is not available, I wouldn't even think about abusing alcohol. But once I see people abusing alcohol and there's that influence, environmental influence, okay? When we look at pethidine, it's available to medical practitioners and it's a painkiller. I have seen medical practitioners who use it as a form of dealing with their pain issues, those with, menstrual pain and others. And in the beginning, it was just to take off the pain. They didn't plan to abuse it. But after some time, even in the absence of pain, you need to take the drug. And so because it's available and they can actually just write a prescription and get it, they will just go and get it. That is why it is common among medical practitioners. Yeah.
Wow. So that is a very great point, because that is making me think, because as you mentioned, at first it was just taking care of the pain and now it went into abuse. So I guess at what point does the person goes into sort of addiction or abuse of the drug? Like, I don't know if you understand the question, because once you mention like, okay, at first it was for pain, and now like they had to take it even if the pain is not there. So at what point do the person make that transition to that phase?
Great, thank you for that question. So the individual thresholds are different. So I may take longer at the tolerance, or let me say the abuse level before getting to tolerance, or a shorter period, depending on my threshold. All right, somebody may use the drug for like over a year and may still be at the, at the normal level. They can still control the behavior. All right, so it depends on the individual differences. But I start using pethidine for my menstrual pain. Okay, so at that time of the month, I just take, a dosage, okay, just to take care of the pain. Now, as I said, that medication is addictive. So it starts changing the chemical, it brings chemical changes in your brain, or it leads to chemical changes in your brain, okay? You get to a point where the normal dosage you were taking, let's assume you were taking 1 ampoule, okay, to take care of the pain. It will get to a point that 1 ampoule, you take it and the pain will still be there. So you need to take 2 ampoules. And you continue over time. Now you have to take 3 ampoules when the pain comes. Then it gets to a point where even without the pain, you have to take the medication just to feel okay. You get it? But there are individual differences. All right. That's what happens. But then the point where you want to even go and steal money, or first of all, you start using your investment, your savings to just fund the drug. You understand? One of my patients says he uses about 2,000 Ghana cedis every day on drug. Wow. And if he doesn't take the drug at all, then that's like 500 Ghana. That's the starting point, the starting dose. You get it? So I mean, it happens. You get to a point where you have to increase the dose. Then there's a point where you don't use it because of the pain anymore, but now it becomes part of your system, like the air you breathe, as I said earlier on. So you need to just take the drug to be who you are. or else you are going to suffer the withdrawal symptoms. Yeah.
Well, I know that you talk a lot about withdrawal symptoms, which definitely we will go into, but out of just curiosity, so then what are some signs that someone needs to pick up on to know that this thing is really transitioning into addiction rather than just being something for me to really sort of handle my pain? What are some signs that someone needs to pick up on to be able to identify the stage that they are in?
Okay, so some of the signs that we can look out for, number one is loss of control. So the person cannot control the use of the drug or the behavior. And they may even lie about using the drug. So you find an addict or hooked on substances, and you ask the person, they can swear that they don't even know what the substance looks like. At that point, they know there's a problem. They know there's a problem, but they can't do anything about it. And they even feel guilty after engaging in the act or use of the drug. They feel guilty and they regret, but they can't do anything about it. And we also look at the withdrawal symptoms. Some examples are tremors. So the person can be shaking when they don't get the substance. When they don't get the drug, they'll be shaking. Some of them, they sweat a lot. Some can't sleep at all. They cannot sleep if they don't use the drug. And some of them can even have seizures. Some can even die when they don't use the drug. There are a lot of the withdrawal symptoms. There are anxiety, sleep problems, and all sort of stuff. Once they don't use the drug, they'll start having those serious symptoms. Then we have social withdrawal. The person doesn't want to socialize anymore. They lose interest in regular activities that they used to have interest in. Their circle of friends changes. Their friends are people who are into the drugs. They don't relate with normal people anymore. And anybody who tries to judge them, they have problems with you, right? And then there's increased risky behavior. So they engage in very risky behaviors like unprotected sex, use of contaminated needles, and gambling, and a whole lot of stuff. Also risky driving, use the substance and drive. They may become problems in the society. They may become deviant or social deviants, all right? So I think basically these are some of the things that you will see to know that somebody is suffering from addiction.
Awesome. And there's one interesting question that is someone is asking, and they want to find out whether betting, like soccer bet, is a form of addiction or can be a form of addiction.
Yes, well, it is. We have betting addictions as well. Yeah, so soccer bet can be an addiction. Once it gets to a point where you want to stop, but you can't stop. And you can even go and bet your last money, and when you lose, you can even go and take a loan to bet. Once you start engaging in things like this, we know it becomes an addiction. You can't control the behavior. Yeah.
Okay. All right. I think we will want to dive in. I know you've been talking about withdrawal symptoms, and we want to really, for you to explain what that means, because probably for me, I don't even know what that means. So.
Okay, so withdrawal symptoms, just as the way the word goes, withdrawal. So when we withdraw you from the substance, or withdraw the substance from you, or when you don't get the substance, the signs and symptoms that you present with, those are the withdrawal symptoms. And the examples I gave are seizures, tremors, anxiety, insomnia, that is inability to sleep, excessive sweating. So those are the withdrawal symptoms. It means that I'm an addict. I'm an alcoholic. And all of a sudden, somebody says they're not going to give me the alcohol anymore, or I engage in a behavior and I'm arrested. So I'm in the prison, okay, or I'm behind bars and I'm not getting the alcohol to drink. I will go through withdrawal symptoms. You understand? So that is just the explanation. Yeah.
Explanation. So, so what are some ways people can overcome addiction, or even prevent getting to that stage?
Well, first of all, let's look at from getting to that stage means that when we are doing this education stuff, this mental health awareness workshops and all that stuff, or you watch a TV program and you know that you are using a substance. Maybe you are not addicted yet, but you don't know your threshold. You don't know when you will switch from the, how do you call it, the regular use to tolerance to dependence and all that stuff. So you just have to say no to drugs. You understand? Just say no to drugs. At the point where you can control it, say no. It's better that way. Well, I know some will collapse, but this is the best to overcome an addiction. The first thing is to admit that you have an addiction. You must admit. We don't expect people to judge. Don't worry at all. Just admit and seek professional support. Okay, talk to a clinical psychologist, talk to an addiction specialist, walk into any clinical psychologist office, and you can also contact us at OKB Hope Foundation. The helplines will be given out, and then we can lead you through the stages. You also have to appreciate the benefits of calmness. Identify what triggers your addiction. If maybe somebody say something harsh to you and you have to go and take alcohol because you don't want to respond, or you need to take the alcohol and then you can perform on stage. So like some of us, the musicians, you want to take something to just do away with your fears, identify those triggers, okay? Then if you have to change your environment, that's some of my patients, I tell them you actually have to change your environment, because if we discharge you, go back to that environment, chances are that you're going to come back. There was a patient who was in the rehab for like 8 months, went home, and the next day he was brought back. And the thing is this: let's say before he he was admitted, maybe he was taking 10 bottles, okay, of an alcoholic drink or beverage, and he was brought in, okay. After 8 months of not engaging or not taking the substance, the body goes back to normal. The person goes back home and feels that, oh, I'm not going to take 8 bottles or 10 bottles. I'm just going to take half a bottle. I'm not sure that will give me a problem. But because the body has gone back to normal, that half a bottle may make you go through the stress of what 10 bottles will make you go through. I don't know if you get the concept, because you've been off the drug for some time. You get the point, right? So we encourage that you change your environment. And also, addiction is a behavior. It's a behavior problem. And if you are dealing with a behavior problem, you have to introduce positive or healthy behaviors. So sometimes engage in sports, exercise, get a new circle of friends, people that will take you to church, people that will take you to the mosque, people that will take you to religious gatherings, people that will make sure you go to school. Change your circle of friends. And that's the only way you can do it, because if you go back to the same friends, the influence is there, and your willpower may not be that strong. They may overcome you and you go back into the behavior. Well,
awesome. Before I ask my next question, there is one question in the chat that I wanted to read to you, and then get your thoughts about it. So this question is: I'm a PA who is a pethidine addict. Doctors and nurses have tried. I have a PA who is an addict. Doctors and nurses have tried to help him severally, both in hospitals and specialist care, and on countless occasions, but still the relapses still occur. And so what they've started doing is that they've ignored the person and to serve as a negative reinforcement. And I think the person wants to know, is this a good or a bad thing to do?
We don't ignore people. We still have hope. Addiction is a very serious thing. It's a chronic behavior. It doesn't go overnight. It's when you get to a particular level, the consequences are severe, and the person is aware of them, but they can't do anything about it. They are helpless. And so they constantly need help. What we do is we do a detox for the person. On a normal, your liver helps detoxify your system. But we give some medications and some IV fluids that will help detox your system and also treat the withdrawal symptoms. Some of the drugs we give at the hospital to help you deal with the withdrawal symptoms act like what you are addicted to, so you don't miss the drug so much. But this time we are giving it at a monitored dose. We monitor it and we reduce the dose gradually. So it's not like the addictive behavior where you increase the dose over time, but this time we are decreasing it. And then we use counseling a lot, psychotherapy, and all that, those stuff to just help you build that willpower. And we have to constantly check up, do follow up. You know, we make you join, were previously addicts but have been able to come out successfully, because what you feel, sometimes the health professional has not felt it before, so they are not able to help you. But these people who have been in your shoes before can tell you how they came out of it, and it becomes a motivation. So it's a lifelong journey. It's not an overnight something. So we don't have to give up on those people. We have to try. We shouldn't judge them. We shouldn't say they are stubborn, they don't want to stop. It's a difficult journey. You can even use your phone as an example. How you wake up in the morning and the first thing you touch is your phone. Sometimes you know that, Charlie, the thing is weighing you down. You want to stop, but you don't even plan to touch it. Your body moves to the phone without your permission. It's like something else is controlling you. So it's no more you. Your willpower is gone. You know, the addiction becomes your control. It controls you. It tells you what to do. Sell your TV and you have to obey. It becomes your God. We need to replace the behavior. And
I think we missed the last part of it because the network wasn't stable.
Sorry. So yes, I was saying that we don't have to give up on the people because it's a lifelong journey. And when you come to the hospital, we detox you. So we cleanse your system of the substance, okay? And then we give you drugs to treat your withdrawal symptoms. At the same time, we are educating you to help you build a strong willpower and also give you opportunity to replace the addictive behavior, the negative behavior with positive behavior. So we also introduce you to the Narcotic Anonymous and the Alcoholic Anonymous group. And I was saying that these people, they have felt what you are feeling. Some of the medical practitioners, they don't know what you're feeling. They are only dealing with you based on what we've learned. But the Narcotic Anonymous and Alcoholic Anonymous groups, they are drug addicts who have successfully recovered or who are recovering. So they understand your language better. So being in that group motivates a lot. It's a serious thing. The last time I was, the addiction specialist in my hospital was taking me through some of the things they do. And I was like, it's a whole religion on its own. Once you join, it's how do you call it? It has a better success rate than when you are home. And we shouldn't give up on people because the addiction steals your willpower. It controls you. I use the phone as an example. I said, look at the way when you wake up in the morning, you go and touch your phone. Sometimes you don't want to touch it. You write New Year resolutions and all that stuff. January, you try. By February, you start touching the phone. And by March, you forget you even had a plan. And the next time is December. Wow, I have to start all over again. It's not easy, you know. Yeah.
Awesome. And so that leads me to my other question. So how can someone help a friend out? So if you notice that your friend is having this or showing this kind of signs, or is addicted to something, how do you, help your friend out?
Okay. All right. Well, I would say that you have to be non-judgmental. You don't have to judge them. You have to be empathetic and you have to be kind to them. Understand that it's a disease. Just like when somebody has malaria, you don't control the fever. You don't say, I don't want this my malaria, I won't have fever. I just want to have headache. Or this malaria, I won't have headache. I just want to have a loss of appetite. No. The symptoms, they just come. You don't control it. So don't judge them. Be kind. Try to understand that it's a disease and help them find the right support. Help them through the addiction. and listen to them more than you speak. Don't try to advise, teach them. Listen to them. Let them share their pain and their whatever they are going through with you. And after listening to them, then you help find a way to overcome it. So refer them to a professional. Take their feelings seriously. What they are feeling, it's a serious thing. Don't make a joke out of it. Refer them to a professional. Yes, if you have to talk to an addiction specialist or a counselor about that, you can do that. And let them know that what they are going through, there is a way out. They shouldn't give up on themselves. So, yeah, these are some of the things you can do to help a friend.
Yeah, definitely. Thank you so much for sharing. I know you've mentioned a lot about if someone or you find a friend going through all these challenges, refer the person to a specialist, refer the person to like a mental health care provider. And I'm just curious, are resources readily available for people to be able to send their friends? Like, well, how is the situation? I guess, how is the situation in Ghana? So let's say if I find a friend and I want to refer, like, how easy is it? Or like, do we have enough resources to be able to, do that?
Well, I'll say for the resources, we have some. We have some of them. It may not be adequate like some other countries, but I think what we have is not bad. We have some rehab facilities in Ghana. I am at the Accra Psychiatric Hospital, and I think what we have over there, we recorded some success. Stories, and also Pantan has some, and I know of some private rehab centers. And so, well, for now, what we have, we'll make use of it. And so if anybody has any referral, yes, you can refer to these centers. It's just that it's a little pricey, but, well, that's what we have now, so we'll just do with it. But there are facilities that are there to help people with these problems. Yeah.
Okay. Awesome. And that, out of curiosity, I just wanted to know, so like, how big is this addiction issue in Ghana? I mean, have you, from the work that you're doing, have you seen an increase in addiction, or people getting addicted to something? And if so, what are the demographics? Do we have, I guess, a lot of males versus females or children? Like, how can you tell us a bit more about, the challenge of addiction in Ghana based on your experience or where you work?
Well, I'll say that I may not be able to give the exact figures, but the numbers have increased over recent years. Last year, there was a survey that was done in a primary school, and even between primary 1 and primary 3 pupils, I don't know what word we use for them, but children are even aware of wee toffee. I've not seen it before. And some of them are even selling it. Their parents sell them and they give it to them to come and sell. So they are already exposed. And so some of them have even tried it. So at this young age, by the time they get to JHS or SHS, they have overindulged in the activity. And also the people are also discovering new things. I didn't know about super glue until last year. I was told some students are even sniffing super glue. You know, in the secondary schools right now, the percentage of students using who are abusing drugs have increased. And this has also led to increase in deviant behaviors. And people don't really care about important stuff anymore. They can leave class and go and engage in the addictive behavior. So it is becoming a very serious issue. And if care is not taken, in the few years to come, crime rate is going to increase. People are going to be stealing. People are going to be selling their parents' stuff. People are going to be committing crimes just to fund the addictive behavior. So I think what we are doing here is very good. Creating awareness, and also early referral. It's a good way to go. We have to go into the world, preach the gospel, and then try and save. The generation, because it's getting worse by day.
Wow, that is very, very surprising. I mean, and also serious, because at that very young age, and I mean, this is my first time hearing about
Yeah.
I guess my last question that I really have for you is that, are there any sort of myth and misconception about addiction? Because I know that in our country, definitely we are very religious. I mean, statistics show that about 70% of the population are Christians, 16% are Muslims, and the other percentages are other religions. And so, are there any sort of myths and misconception when it comes regarding, like, religion versus all the mental health challenges as well?
Yeah.
Are there anything that you could share with us on that topic?
I think there are a lot of them in our part of the world. Most things are attributed to spirit, and it's somebody in the family that is doing somebody, and so even before they bring the person to the hospital, they have tried other things, and the condition has worsened before they come to the hospital, and it becomes difficult. But I think that with the education that is going on, we are trying to clear some of these things, even though some parts of the country still holds on to this spiritual and evil spirit stuff. Yeah, but those are some of the things. Some people also think that it is not treatable. Well, it is treatable. It is treatable. Some people have been treated before. The fact that it was unsuccessful for one person doesn't mean it's not treatable. So those are the two things I'll talk about. Yeah.
Awesome. Well, thank you so much. And to the audience, please feel free to, put your questions in the chat, and I'll read. I know that we are coming close to time, so if you have any questions, please feel free to put that in the chat. So I would like to know, so what are some takeaways you will leave with us? As we end this session and move on with a normal life, what are some key takeaways you give to us, whether that is, advice on how to help a friend out, or even if some of us are going through that, like, what are some key takeaways you leave with us so that we can stop, the addicted behavior, or even going through all the stages that you described earlier? If there are any key takeaways you will leave for us.
Okay, thank you. I would say that, first of all, it is not the end of the world. If you have an addiction, it's not the end of your world. There is a way out. Okay, don't be too hard on yourself. Draw or write down small goals. Don't try to change overnight. Okay, you can even try and reduce the use of the substance gradually. Just try. And don't give up. Sometimes set reminders that today I'm trying to do this, and whatever. If you are having withdrawal symptoms, feel free to talk to a professional. Don't feel bad. We treat these things with a lot of confidentiality. So feel free, don't keep it. The more you keep it, the more it is going to harm you. So don't keep it, talk to a professional. And let's not be judgmental. Everybody goes through a phase in their life. Let's not be judgmental. You don't know what will lead you. Some people, they are not bad people, or they made a bad decision. They just went through a bad moment in their time, and they decided to just help themselves, which most of us have done other stuff to help ourselves. To somebody, alcohol was the one available, and at the first drink, the journey of addiction started. So don't judge people. Let's listen to people and try and help them. Yeah. And the last one is, say no to drugs.
Wow. Thank you so much, Mr. Eloyd, for this wonderful session. Seems
You're
that
welcome.
there are no questions in the chat, so I think definitely we would bring this section to a close. And definitely, once again, thank you to all audience who were able to join this insightful conversation. I hope that everyone took something that they are going to share with their friend or share with their network. And so I really appreciate everyone here. And also, once again, thank you so much for our guest speaker today, Mr. Jason Eloyd, for definitely enlightening us on the different stages of addiction and how we can help our friends out. We really, really appreciate your time. I will bring this session to a close. Next week, we will have another one. I mean, more information will be coming out on that as well. We will have another guest speaker who will be giving us another insightful discussion on another mental health topic. So definitely stay tuned. You can follow us on our various social media, platforms to see the different topics that we'll be discussing next week. But once again, thank you all for joining the meeting today. Really, really appreciate it. And you all have a wonderful rest of your day. Once again, thank you.